My name is Elisa Arona.
My name is Brian Chung.
My name is Lynn Lee.
I'm the project administrator for the Patient Navigation Center here at Asian Americans for Community Involvement.
I'm a mental health peer support worker.
And I'm the director here at Optimal Hospice.
I think access to accurate translation for monolingual patients is a huge issue. These are huge gaps, and I think it's very prevalent, especially in Santa Clara County, where you have a third of the population who's Asian. I think it's something like 40% actually speak a different language, and then you have another third of the population that are Latino and speak Spanish. So these are large groups in our community who are facing these kinds of barriers every single day. Now, I think that actually causes issues, that you have someone, let's say a much younger person than the patient, translating, about things that they don't really understand without the language, let's say the medical terminology necessary to really describe and give accurate information. I think the other thing is that it puts the translator, let's say the family member, in a really, I think, a compromising position, because often they may be delivering information that's shocking. I mean, it can be very, it can be news that the patient may not want to hear or accept, and not to have the training to do that is really, I think it's unfair to that family member, and it can have obviously negative outcomes.
Often, when a family member translating can be helpful, and the family member's presence can be supportive, but sometimes, whether it be medical terms or maintaining accuracy or fidelity to the medical staff, that can be a challenge.
They're not at all. And I know that for a fact because the Vietnamese families, I think the only service that they know is if something happens, they go to the hospital, or they call 911 and you go to the hospital, and then whatever happens in the hospital, sometimes they don't even know what goes on in the hospital, because they don't question it. They think doctors know it all. They think the hospital is supposed to take care of you, and they think that, that's it. But there's just so many other services out there that nobody knows about.